How's this? Sorry about that. All right. So, good evening, everyone. Welcome to Salone Health Educational Program. This evening, we will be presenting Salone versus COVID. My name is Dr. Denzel Cole. This program is aimed at providing information regarding the disease, symptoms, and preventative measures, as well as identifying credible sources of information. Salone Health is an organization of Sierra Leonean professionals dedicated to promoting the health and wellness of our people at home and abroad. We have several areas that we are focused on. As an organization, we are focused on health education and promotion for the Sierra Leone community, providing training and workforce development of valuable skills, as well as providing mentorship and networking opportunities. This is our way of giving back to the community, which has given us so much. Sorry. Please visit our website, Salone Health, for more information and resources. We are also available on Facebook, Instagram, and Twitter. We welcome all in our initiative.
All right. Salon people ona kusheo. So good evening, everyone. I am Dr. Fatou Forna. I am an obstetrician gynecologist and epidemiologist. So welcome again. We thank you for joining with us to learn about COVID-19 and how it's affecting our community. So before we get started, this is going to be a very interactive discussion today. So we want to hear from you. We want to hear about some of the questions that you have. So I'm going to pose this to you, members of the audience. Throughout this discussion today, send us messages. We will listen to them. We might not get to everything immediately, but we'll try to get to them at the end. So please send us your questions. So this is the Ask the Audience section. The first question we have, next slide. So we want to know, have you or anyone you know tested positive for COVID-19? We want to know how this is affecting the Salone community at home and abroad. So let us know. And when you are sending us that question, please also let us know where you are listening from. We know some of you are listening here in the US, and some of you are listening from Sierra Leone, from the UK, from everywhere around the world. So let us know where you are listening from, and have you or anyone you know tested positive for COVID-19? And I'll be sharing some of those answers with you, or with all of us. All right, we have Rahim, who's listening all the way from Portugal. Welcome. I know earlier we had someone who was listening from Houston. Send us those. Send us your questions. So we have Belinda from Atlanta. So welcome, Belinda from Atlanta. Yasmin is listening from Connecticut. Welcome, Yasmin. We're happy to have you join the conversation. People here, Salone people from all over the world, please send us your questions, your comments directly. We have Bomaya from New Jersey. Welcome, Bomaya. Ezekiel, all the way from France. Welcome. Khadija is from London. So thanks for joining us, Khadija. So we really have people from all over joining us. Hamida from Houston. So thank you for that. All right, so have you or anyone you know tested positive for COVID-19? And while we're waiting for those questions, I know personally I've had family members who've had COVID-19 here in the US, in the UK, so I know this is something that is really affecting us. So as those questions are coming in, maybe we can go to the next question. The next question is there anything that confuses you about COVID-19? We know it can be very confusing. What are some areas that are confusing that maybe you want us to talk about today? We have all these amazing experts, Sierra Leoneans here to discuss with you. So let us know if anything is confusing that you would like to hear more about. I know there were initially some challenges hearing us. Sorry about that. I hope that everyone can hear a little better now. And if you are listening and you have the link, you're on Facebook, please share this so that other people can join, other Sierra Leoneans can join. So please share widely. We can also go to another question while people are thinking about if there's anything that confuses them. Another question is, what are your biggest concerns about COVID-19? What are your biggest concerns about COVID-19? So chat with us, share your questions, and if we don't get to it now, we will definitely get to it a little later. All right, so some of the concerns that we've been hearing are, people are worried about the fact that there's no vaccine. People are worried about the fact that we don't know how long this is going to take, when it's going to end. So we had, I had a concern come in. One of our listeners said, over here in the UK, Black and Asian people are more likely to die from COVID-19. However, the numbers aren't as high as in African countries. Does this have something to do with climate? So thank you for that. Those are areas that we will be going over. Does heat kill the virus? We actually have a section where we're going to be talking about, what are myths and what are real. So thanks for that. All right. So maybe while we have some questions coming in, we can get started, and I'm sure we will be able to answer a lot of those questions that you are sending in. Thank you for those questions. Next slide. All right, so I will start, and I'll give an overview of COVID-19, but today, expect that we're going to have different doctors, different public health practitioners who are going to talk to you about the disease, COVID-19. We're going to talk about some of the data, some of the many different areas of COVID-19. So we have different speakers and we will have different sections. And at the end, we will talk and answer specifically to some of the questions that have been coming up. Next slide. Okay, as I mentioned, just to give you a brief overview of the program, we've already had the introduction by Dr. Cole. I will be talking briefly about COVID-19, giving an overview, and then we will have Dr. Sharif, who will talk about COVID by the numbers. We'll have Ms. Kemokai talk about prevention and testing. Ms. Siddiq will talk about information sources. We have Dr. Metziger, who will be talking about mental health, which is so important. And then we'll have an open discussion, question and answer, testimonials before we close. So that's just an overview of the program today. Next slide. Next slide, and we'll start with an overview. COVID-19 has been really tough, I think, for a lot of us. And I wanted to give some perspective. The pictures on this slide represent, they come from the New York Times. The New York Times in April of this year did an article where they shared photos from a century of epidemics. And basically, these pictures show that the different outbreaks and the different epidemics that we've been through as a world and that we've been able to overcome. So I want to go through a few of these just to let us know that we're going to be able to overcome COVID-19 also. We've had the Spanish flu in 1918 to 1919, which had an estimated 50 million people dying. The Hong Kong flu in 1968. We've had HIV in the 1970s and 80s with about 30 million dying. We've had MERS, we've had SARS, and we've had Ebola, which affected us in Sierra Leone with over 11,000 deaths. Next slide. Of course, we now have COVID-19, which is affecting us currently. And for COVID, we've had over 415,000 deaths. Next slide. So let's define coronavirus. Next slide. Coronavirus is a large family of viruses which can cause illnesses in animals or in humans. Mostly, they cause respiratory infections. They cause the common cold, for example, but they can cause severe diseases like MERS and SARS that caused a lot of deaths in the past. And most recently, of course, causing COVID-19, which is a global pandemic affecting many countries, but it originated in Wuhan, in China, in December of last year. Next slide. There are many, many, many cases around the world. COVID has affected nearly every area in the world, but you can see areas that have been hard hit have the deep red. North America, South America is now being infected a lot. Of course, there were many Asian countries, Europe, and you can see on the map, Sierra Leone is affected as well. Next slide. The United States, of course, has been impacted. There are areas in the US that have been more impacted than the others. We hear a lot about New York, but in the South, Florida, Georgia, California, multiple areas areas have been affected. Next slide. COVID has affected different demographics and racial groups more than others. Here in the US, we know that African Americans are the group that has kind of been affected the most, highest rates of COVID infection in general, of hospitalization, and of death. Also Hispanic Americans, those are, and of course Native Americans. Those are some of the groups that have been impacted, showing the racial health disparities that we see with this example showing New York specifically, but we see this picture in other areas around the country. Next slide. Transmission, we know that the virus transmits mainly from person to person and is transmitted through respiratory droplets, so close contact. Next slide. How can we prevent transmission? You know, that's very, very important for us. You know, some of the things that we can do is washing our hands often, avoiding touching our eyes, our nose, our mouth, our face in general. Wearing a mask is very, very, very important. So making sure we wear a mask around others, making sure we cover our coughs and our sneezes, and cleaning and disinfecting surfaces frequently. And most importantly, one of our biggest tools we have is social distancing, making sure we stay far away, at least 6 feet from other people, you know, if we're in groups. Next slide. This, you know, is really a nice picture that shows some of the effectiveness of wearing a mask. If someone is infected with COVID and is not wearing a mask, and they're in close contact with someone else not wearing a mask, the protection there is very minimal, and your risk of catching the disease is high. If you wear a mask yourself and the person infected doesn't wear a mask, there's a little bit of a protection, but not a lot. But the most protection we have is when both people wear a mask, the person who has the infection and the person who doesn't. So we want to implore our communities, the Salone people there, let we make sure say we all they wear mask. That is one of the biggest tools we have to fight this disease. Next slide. We do have to protect our most vulnerable people. You know, people that are older, people that have comorbidities, you know, people that have infections, but we know with COVID-19, even people that we think are healthy can be infected and can be very sick. So the way we can help to protect our vulnerable people is limit your errands. If you don't have to go out, don't go out. If this is something that can be handled remotely, handle them. Avoid caring for children and those who are sick. You know, if you know that you are infected, of course, we want you to stay home. And socially distance yourself. If you have a member of the family who's sick, make sure that person is staying away from everyone else to try to minimize everyone getting that infection. Next slide. Staying home is very important. You know, these are pictures, you know, I believe it was last month in Atlanta, where when things opened back up, we had a rush of people going to parks. We had people at a mall. Those are things that really put you at risk for getting infected. So we understand that if you're critical, you have to go to work, you have to get groceries, you have to get food, you have to seek medical care. But if you can, try to stay home as much as possible. It will keep yourself and others safe. Next slide. You know, this, you know, it's a really nice graphic that shows some of the symptoms of COVID at the top. You might have a fever, you could have a cough, You can have difficulty breathing, muscle pain, tiredness. Of course, there are many, many other symptoms, but these are some of those symptoms. Social distancing, at least 1 meter or 6 feet apart. We talked about use covering your cough, washing your hands, avoiding contact with sick people, minimizing human contact and contaminated objects. So we've talked about all of those things, and most importantly, using a mask when you're outside. Next slide. What do we do if we're sick? If you are sick, very important that you stay home. Very important that you monitor your symptoms. You get rest, you stay hydrated, and you call your healthcare provider to get advice. A lot of people that have COVID have mild illnesses and they can stay home and do symptomatic care. However, if you are sick and you feel like you are getting worse, you have shortness of breath, chest pain, you're not doing well in general, then you call your healthcare provider so that notify them about your condition and so that they prepare for you in case they tell you to come in. Covering your cough and sneezes, we've talked about that, washing your hands, often staying away from other people and not sharing personal items. Next slide. When you're sick, like I said, the majority of people can do well at home, but seek medical attention and call your doctor or your nurse if you're having trouble breathing, if you have chest pain, you're confused. And again, very important to call ahead. And in the US, of course, you call 911 for emergencies. Next slide. In the US, if you are home, it's very important, according to the CDC, there are certain things that have to happen before you can stop isolating at home and, coming back down to interact with your family, going out, things like that. You need to make sure it has been 10 days since your symptoms first started, and you make sure that your symptoms have improved. Your cough has improved, you don't have any fever without taking medication, and you haven't had a fever for the past 3 days. And if you were tested, it has been at least 10 days since you had your first positive test. Next slide. Treatment is very important. This is what we're all hoping for. Currently, there are no drugs, there are no vaccines, and no medications that have been specifically approved to prevent or treat COVID-19. However, we do know that a lot of experimental drugs are being tested. We are using some medications. Some studies have shown effectiveness, and we're hoping that we'll get to the point where we'll say we have a treatment for COVID. We're not there yet. Also, there are lots of vaccines in development. We know there's a rush. We're hoping that in the next year or so, we can have a vaccine. Again, all of that is in the works. What we can do is infection prevention and control, those things that I've talked about already, and supportive care. When you go to the hospital, giving you oxygen, helping you to breathe, helping with your fevers, things like that. Next slide. So that's a brief overview about COVID-19. We now have Dr. Edward Sharif, who's a data coordinator and an epidemiologist. He's going to talk to us and share COVID by the numbers.
All right, good evening. My name is Edward Sharif, and my aim this evening is to talk about COVID-19 numbers, basically statistics relating to COVID-19. As we all know, there's not a shortage of data on COVID-19. Everybody is providing data on the infection, and my aim really is to help people understand how to interpret the data and how to make informed decisions in relation to prevention. Because ultimately, the fight against COVID is, it lies with the individual. The individual has to decide what to do. So next slide. So it is important that when we look at the COVID numbers, that we understand that these are individuals just like us. So any one of us could actually be in that statistics. So maybe if you look at it from that point of view, it makes the situation important. So basically, globally, we're approaching 8 million cases and close to 500,000 people dead from COVID-19 all around the world. Next slide. And this is Sierra Leone. In Sierra Leone, where I believe everybody on this call is from, we're looking at 1,000 cases, a little over 1,000 cases and 51 deaths. Next slide. And in the UK, where we also have a lot of Sierra Leoneans, it is a little less than what we have in the United States, but it is up there. So next slide. And here we have the United States. So currently we are sitting at 2 million, a little over 2 million cases. So this is about 27% of the global cases. Of all the cases in the world, we account for 27%. Now, I don't know how many countries are in the world, but that's a huge proportion just carried alone by the United States. And we are way over 100,000 deaths. Next slide. So now let me talk about the numbers that we see on the news and how to maybe interpret what we're seeing in terms of the spread of the virus. So when we use numbers to interpret or to do surveillance on a specific disease, sometimes people present cumulative cases. So let's say from February 1st all the way to June 12th, the daily number of cases are added up to get the cumulative number of cases. So basically, this is the magnitude of the problem. This is how many people you have with COVID-19 or who have gotten infected with COVID-19. Now, some people recover and some people, unfortunately die. But understanding the magnitude is important. But from a public health standpoint, we want to see how the disease is spreading so we can take measures. And so it is important when you look at the numbers on the news, you have to first ask, are they presenting cumulative cases? Are they adding the cases as we go? Or are they presenting daily number of cases? So what you're seeing on the screen is the daily number of cases. So these are the new cases per day in Georgia, the state where I believe most of the panelists live, including myself. So what you can see the daily fluctuations in the number of cases. It's not the same. Even though we have new cases every day, the number of new cases and the pattern is completely different. And this can be due to the number of tests that is being performed a day, because for a virus like COVID-19, you have, it is very transmissible. So if you're looking at the daily cases a day, it gives you an indication of how well your preventive measures are working. Are the number of cases gradually going down, or are they increasing as we go along? So it is very important that we look at the spread of the disease in relation to the total magnitude of the problem. Because from a public health standpoint, we don't want people to catch the disease. We do worry about people who've already caught the disease, but once you've caught the disease, we're trying to prevent you from spreading it to another person. So next slide. So basically, overall, the numbers do not tell the whole story, but you wouldn't have a story without the numbers. So it is important to not just look at the number of cases, you have to take the population of the geographic location into consideration, because two locations can have the same number of cases, but when you look at the rates, per population, per 100,000 population, you have different rates because of the population size. So when you look at the numbers, also try to take into consideration the age distribution, the sex distribution, because as we've seen, the racial distribution, as we've seen, all these things play a role in in not just acquiring the disease, but also in the outcome of the disease. Next slide. For example, here's France and Peru, two countries with, close, almost, you can compare the number of cases per country, but when you look at the case rate per 100,000 people, you have a completely different set of numbers. 286 compared to 624, which is, almost more than half. So basically, the numbers do say something about the magnitude of the problem, but relative to other locations. So if you want to compare two places, it is best to take the population of those two places into consideration when interpreting COVID-19 numbers or any other disease. Next slide. And basically that's it for the numbers. We could dive deep, but if you have any questions later, I'm willing to answer any of the questions. Thank you very much.
Thank you so much for that, Doctor. Next, we're going to have Mamawa Kemokai, who's a public health nurse practitioner. He's going to talk to us about the new normal. Mamawa.
Thank you so much for having me this evening. The rules for returning to normal. There are health and safety CDC guidelines for specific occupations. Most precautions are similar for all occupations. It is important for both employers and employees to follow their specific guidelines to prevent the spread of COVID-19. If you have to order food and your other household items online, or you can have them deliver them to your house, or you can pick them up on the curbside. When you do have to visit in person, go during hours when there are fewer people, say compared to morning and late times at night. Next slide, please. Follow CDC steps if you are sick. Notify your network if you are experiencing symptoms such as fever, cough, or shortness of breath. Next slide. Essential errands. Of course, we all have things that we have to do every day. Doctor visit. Use telemedicine if available, or communicate with your doctor or nurse by phone or email. Talk to your doctor about rescheduling procedures that are not urgently needed. For prescriptions, use drive-through windows, curbside services, mail orders, or other delivery services. Next, please. Banking. Of course, we need to get to that money. Bank online whenever possible. Use the drive-through ATM if available. And whenever you go out and you use the ATM, make sure that you use a hand sanitizer that is at least 60% alcohol. Next slide, please. And now we're gonna go to testing. Testing is a very important part of COVID-19, which goes to to catch those that already have it and make sure that you don't pass it on. There are two types of tests. We have the viral testing, which identifies if you are presently infected with COVID-19. The antibody test identifies whether you were previously infected with COVID-19. And when we talk about contact tracing is the process, next slide, please, of assessing widespread exposure. How is testing done? Like I said earlier, for the nasal swab, which is the viral testing, a special 6-inch cotton swab is inserted in the nasal cavity for approximately 15 seconds. It's repeated in the other nasal or nares for another 15 seconds, and it's sent to the lab, and the results is typically available within 2 to 4 days. Antibody testing, you have to go to a place where they can draw your blood, and they send it to test for the antibodies of COVID-19. And sometimes I can tell you if you know similar viruses such as the common cold, they are all in the same family. Testing, you can locate testing site by going to the CDC website. There's a lot of information on the CDC website. If you go and just enter in the search box and just ask for what you need. Next, please. Thank you so much for having me.
Thank you very much, Mama Wa. Next, we are going to have Yema Juliet Siddiq, who is a management analyst and founder of Project Womb. She is going to be talking to us about information sourcing. Thank you, Yema.
Thank you, Auntie Unakushe. Good evening. My name is Yema Juliet Lamine Siddiq. And today I just want to talk to you about reliable information sources. With so much new information continuously evolving around COVID and still so much uncertainty, understandably, we want to keep our family, friends, and loved ones as up to date as possible. But with WhatsApp, Facebook, and other social media outlets, it's very easy for the fast spread of false information. That's very common and something we've been seeing frequently throughout this pandemic since its beginning. And while sometimes our intentions are completely harmless and we're just trying to keep everyone as up to date as possible, it can be really dangerous instead of helpful when people are receiving instructions that are false about evidence-based public health interventions. And so it's absolutely imperative to make sure that your information and sources are accurate prior to sharing them. So today I just want to speak to you briefly about how to make sure we're spreading accurate information. Next slide, please. So some really credible sources just that are organizations, the WHO, the World Health Organization, as well as CDC, Centers for Disease Control and Prevention. Now, these are really good organizations because essentially they have an obligation to give us up-to-date and accurate information. State and local government websites as well, local news information sources. The WHO more so provides recommendations for the world, so on an international recommendation basis. And it may not exactly be too specific to the US sometimes, which is when we want to go to the CDC or we want to go to the National Institutes of Health, NIH. Next slide, please. Oh, sorry, could you go back 2 more slides? So I just want to talk about knowing the logos. Knowing the logos basically meaning when something is verified or not, because a lot of what we'll see is false information that comes from something that looks like it's a credible source, but it's really actually not. So one way that I do it to help me sometimes is to look for the blue check, especially on social media. If you're just looking for something very quickly, you want to look for the blue check. You want to, of course, check the original source from your forwarded messages. A lot of us are getting tons and tons, hundreds of messages on Facebook from worried family members, back home in Salone or even just here because we're not really sure what's going on and because of the uncertainty. So sometimes it can be hard to filter exactly what is true and what's not. And so one really good way to do that is to just go to Google and try to find that source and where it came from. Visit your local and state health department websites. And if you can't get to their websites, go to their social media. Again, familiarize yourself with these logos because it really comes in handy in terms of using it against false propaganda out there. Next slide, please. Next slide, please. I just really briefly want to show what a verified organizational account would look like. One thing that I was very surprised to see that I've been seeing pretty frequently is that sometimes you'll see a verification from something that looks like it's the WHO or looks like it's the CDC, and you'll see sort of like a blue check copied and pasted into what would be the display picture. But a great way to make sure that you're on a site that has credible sources is to make sure it's next to the name, which a lot of people might sometimes get confused about. Next slide, please. So just want to provide about 7 tips for avoiding misinformation, some of which I've already gone over. But again, learn the basics of the disease. We've gone over the symptoms. So what are the symptoms? How does this spread? We've talked about the spread. What illnesses are similar to COVID? So knowing the difference between seasonal allergy symptoms and COVID symptoms, and when to call your doctor. This is information that can actually arm you against the misinformation that's coming in from all sorts of ways. Be wary of claims about the pandemic that don't really seem to right if you can't find it on Google. We've seen a lot of politicizing of COVID from, the right and the left. It's, again, really important to be aware of those conspiracies and making sure that you're going to actual credible sources of information. Go to a government organization site or go to your local and state government website, or if you have a trusted doctor, maybe try to call your doctor and go there and see if they can provide you verification for the information that you're getting. Verify images and videos related to the pandemic. Again, it's really easy to push out misleading context, especially in a time like this when people know what about the large fear that's going on. It's really easy to push inaccurate propaganda out there. One thing that I do want to point people to is if you Google WHO Mythbusters, it's sort of a good forum site to check and see if your information is actually accurate. Use reverse image search. That is also another good route to check your information. Don't share prevention or treatment methods without consulting official sources first. And of course, still make sure you're looking for what's unknown. And this next slide, I just wanted to point out that, again, there are lots of myths coming. One major one is that, if you're somewhere really hot or sunny, that you can't catch COVID. You absolutely can. It's a fact that most people who do catch COVID-19 will recover from it. But again, it's a very real disease. And that is probably another thing that I really want to stress, is that even exposing yourself to the sun or very warm temperatures isn't necessarily going to prevent nor cure you from COVID. So once more, if you don't know where your information is coming from, before you send it out, before you send out inaccurate public health interventions strategies, please check to see where the source is coming from. You can always do a simple Google search. You can check your local and state government websites, and that should help you out a lot more and greater help everybody else out so we can tackle this thing.
Thank you so much, Yema. Next, we're going to talk about mental health. We have Dr. Aisha Metziger, who's a licensed clinical psychologist and an assistant professor. Thank you, Aisha. Dr. Metziger.
Thank you, Dr. Forna. Unakushe. I want to spend some time today talking about mental health and psychological concerns that you might have, because we're dealing with a novel version of coronavirus, and because our lives have changed relatively significantly in an attempt to control the spread of COVID-19, there are some mental health reactions that we want you as our audience to be aware of. Next slide. It's common to experience stress or a change to your thoughts, your feelings, and your behaviors, as we are all adjusting to living and trying to thrive in these very uncertain times. So in general, you might experience fear and worry about your own health or the health of your loved ones. We want you to be on the lookout for some specific changes that, if they do prevent you from carrying out your daily responsibilities and normal functioning, might let you know that you need to seek professional help and support. So first, we want you to be aware of emotional changes. So these might be feeling socially isolated, feeling guilty, feeling numb, even feeling hopeless or helpless or angry, even feeling frustrated about just being cooped up in the house or not really knowing what's going on with coronavirus and the status of the world right now. We also want you to be on the lookout for behavioral changes. So if you notice any changes that are significant, so that might be changes to your sleep pattern, changes to your appetite, your energy levels, your activity levels, or even your concentration as you're trying to work from home or go to school from home as well. So last, we want you to seek help for any physical reactions that you might experience. So rapid heartbeat if you're experiencing that, if you're having panic attacks or body pains, stomach problems, headaches, or skin rashes. These are all physical reactions that people might experience on a smaller scale, but if you are experiencing any of these stress or worries, or physical or behavioral symptoms to a degree that's getting in the way of your daily life or causing you not to be able to take care of yourself, or again, this is when you would want to seek out professional help. Next slide. So in terms of taking care of others, a lot of our audience might be parents or caretakers of children. So we do want you to be on the lookout for some child-specific reactions or just signs that your kiddos might have problems adjusting or might need some outside help as well. So that might be excessive crying or irritation in young children. So if they're just in general more fussy or irritable than normal. Also, any problematic behaviors or social conflicts. So if they are arguing more with their friends, with their siblings, even with you, that's something that you might want to be on the lookout for, just as a reaction to how everything is changing and how they are adjusting to life right now. So also be on the lookout for poor school performance or avoiding online school. A lot of us are out of school right now, but if that's something that you're noticing, your kiddo's not wanting to sit in front of the computer, right? That might be something that you could have your kiddo's teacher call them for a one-on-one session, for example. Again, in children specifically, we do want to be certain to look out for physical reactions. They might be more noticeable. Kids may be able to express those reactions more. So if they're saying, oh, my tummy hurts a lot more than normal, if they're having more headaches, for example. And for all of these concerns, this is something that currently you could contact your pediatrician for. A lot of doctors' offices are doing e-visits, so that's an option that you as parents have. If not, we're going to give some reactions here at the end for seeking mental health treatment as necessary, and just getting access to professionals who can provide cognitive behavioral strategies as well as medicinal help if necessary. Next slide. So outside of seeking professional help, there are things that we can do ourselves as individuals and as a family to help us cope with the stress that we're experiencing right now in terms of coronavirus. So some things that you can do cognitively, you just want to take breaks from watching, reading, or listening to news stories that include media. You can also clear your mind by meditating. You can practice mindfulness. You can pray, you can listen to music, journal, anything that you're used to doing that helps you unplug and really relax your mind is helpful. Behaviorally, it is good to try to keep up with your normal routines, not to put too much pressure on yourself or your children. Again, you should be taking time to unwind physically. We have noted here on the screen that you can take deep breaths, so practice deep breathing slowly in order to calm your body down as well. Also be sure to exercise regularly, get adequate sleep, avoid alcohol and drugs or other coping mechanisms that might be maladaptive and get in the way of your normal functioning as well. Behaviorally, you should also eat healthy, well-balanced meals, make sure you're drinking plenty of water, and just taking care of yourself physically. So socially, we do know that things right now, right? We're living in a time of social distancing. So it's important to be safe, but also to be creative about how we're keeping in touch and connecting with. We're on a Zoom call right now, we're on Facebook, we're on YouTube. There's tons of technology. House Party is an app that I've started using with my friends where you can video chat and play games. So just really be creative about, again, tapping in and staying connected with people who you trust, who you love, who are really going to help foster your peace of mind and your sense of balance right now. Next slide. So for those of you who do have children, we do know that kids have a lot of questions. You're around them more often. They might not be with their teachers right now who aren't explaining to them what COVID-19 is. So we do want to give you some information about how to talk to your kids. There's no one right way to do this. We do want you to be sure to give information as developmentally and as age appropriately as possible. So that just means, first of all, making sure that you're remaining calm, making sure that you are reassuring to your child. The best thing that you can do is to be a role model, right? So children learn from what you do. That just means that for yourself, take breaks, make sure that you're getting plenty of sleep and exercise, and creating the most calm and balanced environment for your child as possible. Also, just make sure that you're available to talk and to listen and to let them know if they do have questions, you're there to answer them. Talk to them about things that they're familiar with, right? So if they're already used to washing their hands to keep germs away, you can use that same language and say, COVID-19 is a different type of germ, but we're used to dealing with germs, right? And we know how to protect ourselves. So this is how we wash our hands, and this is how we protect ourselves from germs, for example. Blue Ivy has a great video on YouTube that you can look at that talks about washing your hands. We have some resources, again, that will provide. YouTube has some Creole videos that you can share with your kiddos. Braspida, you know, begin ton chief, right? So you can look up these videos. They're called Education and Sensitization on COVID-19 on YouTube. But again, just make sure that you are talking to your child in a way that's developmentally appropriate. Avoid language that blames or stigmatizes others. Keep things as fun as possible. So we're not wearing masks because people are dirty and nasty, right? We're wearing masks to protect each other and ourselves from germs. You can make social distancing a fun game. When we go out here to the store, we're going to make sure that we're staying this far apart from everyone, right? And just keep it fun and light for your kiddos at home. And again, provide honest and accurate information. So no matter how tempting that WhatsApp video is to share, it might not be the best thing to be sending to your kids right now. They are already oversaturated with information. Next slide. So we have a lot of essential workers, healthcare professionals, nurses, and doctors in our audience. So we do want to provide some tips for emergency first responders. The first being to be aware of and on the lookout for burnout. So this is something that might indicate that it's time for you to take that mental health day, right? To talk to your boss or your superior about getting some time off. And this is if you're experiencing extreme exhaustion, if you're noticed that you're overwhelmed at work, if you're noticing that you're more sad, easily frustrated, if your hygiene is being impacted, you might also feel like a failure, right? So this is just anything that goes beyond your normal responses to an already stressful job. If you're feeling overwhelmed right now, definitely advocate for yourself and take that time off as necessary. Next slide. And then as burnout is one thing that might happen just due to the nature of our jobs and the frequency and how much we're having to work right now, I do want to mention that for those of you who are experiencing stress or experiencing possibly traumatic experiences, whether that's vicariously or directly with different patients that you're working with, you should be on the lookout for secondary traumatic stress. So this is something that might be excessive fear or worry. If you notice or someone else tells you that you're more jumpy or easily startled, if you're having physical signs of stress, so you might notice that you come home from work and you're still really worked up, right? Your heart rate is still up. These might be signs that you're having reactions after the fact or after the stressful situation, and it might be an indication that you should seek out either time off again or some professional help. Next slide. We want to end the mental health section again by just providing you some resources. If we click to the next slide, we can actually see them a little bit better. First, if you need immediate support, of course, call 911. If someone is in danger to themselves or possibly posing a threat to someone else, that's when you call 911. If you need to use a crisis text line, if you can't talk, the number is there for you as well. SAMHSA is amazing resources for mental health support. They have a toll-free line that you can see on the screen here for English and Spanish, as well as one that you can text. And then if you're not experiencing a direct emergency and you just want general treatment referral information, you can call 1-800-662-HELP to receive that information both in English and in Spanish. Next slide.
All right, thank you for that, Dr. Metziger. We know how challenging mental health has been for a lot of us during this pandemic, so we definitely appreciate that. So now we have come to the discussion aspect of this. I've seen a lot of questions that have been coming in from many of you, so we can now take time to go through the questions and, you know, just have a discussion, answer some of the issues that are really have been on your mind. So I'm going to the top. One of the questions we had, you know, we had a question earlier about does heat kill the virus? And we know Yema had already addressed that, you know, and about people in warmer countries. So we won't talk about that again. One of the questions we have was, what is the recovery time for COVID-19? You know, the recovery time is variable. We know that when people have mild disease, you know, according to the WHO, you usually get better within about 2 weeks or so. But for people that get severe disease, you know, it takes a long time, sometimes even 3 to 6 weeks to get better. There are people who are hospitalized for very long periods of time. And also, even after symptoms have subsided, some people still test positive for the virus for a few weeks. So it's variable, but it can last a couple of weeks. We have a question for, you know, so that question was from Rahim. Thank you for that. Another question we have was over here from Khadija. Over here in the UK, Black and Asian people are more likely to die from COVID-19. However, the numbers aren't as high in African countries. Does this have something to do with the climate? You know, maybe Dr. Sharif, you can talk about some of those numbers in some of the African countries and what we're seeing. People getting infected in Sierra Leone and in other African countries.
So that's a good question. There is, you know, the numbers do say that minority populations, especially in the United States, are at a higher risk of hospitalization and of death from COVID-19. We're not seeing the same being translated in African countries. And from my own personal perspective, I think it has to do with testing. If we're not testing enough people, then we're definitely not diagnosing enough people. And so I believe it's a surveillance problem. And if all the steps are being taken at these, in these African countries, I think we will see similar situations. So I believe testing has to go up, the rate of testing, the availability of it. And if we can address those factors, then we can start comparing, you know, cases and death rates, you know, by country. But we're in Western countries are definitely reporting way more cases and, you know, testing way more people than they are in Africa.
Okay. All right. Thank you for that. Another question we have from Comfort Bell. With more people going about their daily lives now, do you think the second wave would be much worse? And how can someone prevent themselves from that? And you know, just for the panel in general, if there's a question that you feel that you want to answer, please jump in. Otherwise, I'll try to direct it to to one of you. You know, this question about the second wave. You know, one of the things I showed. You know, was the Spanish flu that we had in, in the early 1900s. And in learning from the Spanish flu, you can see that there was a first wave that a lot of people got affected and died. And then their second wave was actually much worse, with a lot more higher numbers of infections and deaths. So there is that concern here with COVID-19 too, that a second wave might even be worse than the first wave. We are actually seeing, for example, in the US, after reopening, we're now seeing in many, many states, the numbers are going back up. For example, in North Carolina, they had the highest number of infections ever yesterday being reported. So we are seeing those indications. And for me, Salone people, them, this now for remind una say, let we sit on our house. Let's not give up on those things that we're supposed to do. Where if you're gonna eat, wear your mask. Wear your masks, hand washing, social distancing. Those things are going to become even more important.
Say something?
Yes, please.
Okay, so with the second wave, I mean, we do hear a lot about the second wave of the coronavirus and the implications it will have on different other things. But, you know, if the infection itself is immunizing, that means if you get corona and recover, if you're protected for a specific period of time, then we might not have, a more gross second wave compared to the first, because then we'll have most people having come in contact with the virus and therefore cannot get infected or spread it to other people. So, but then it could be that you could get infected after being, infected the first time. So if that's the case, and if social distancing is not being applied at all the levels, we will definitely, the possibility to see even more worse second wave is definitely there, and we can't discount it. We're hoping for the best, but we cannot say it's not going to happen, because after you get it, you might not, get infected again. So, but from a social distancing point of view, the less people you interact with, the less likely you are to come in contact with someone with COVID. The more people you interact with, the more likely you are. So personally, if you understand this, I think it should give you the impetus to, stay away as much as possible. I mean, we've done this since February or March, and I think what's left is shorter than what we've already been through. So you might as well just stay focused and continue social distancing until we can get over this. Thank you.
Yeah, thanks for that, Dr. Sharif. This next question, maybe Dr. Cole, you can take it. It's from Riyama Ndong. What are the COVID symptoms for kids? So talking about children. I think you're muted.
Okay.
Dr. Cole.
Can you hear me now?
Yes, we can hear you.
And so for most pediatric patients, the signs and symptoms are similar to adults in that it would be a severe disease, but that's if the child is presenting symptoms. There have been cases reported where children have developed multi-organ system failure. So they've had shutdown of their kidneys, shutdown of their cardiovascular system, similar to what quite a bit of the elderly population has been experiencing. It has not been as widespread, and they're still investigating as to why children seem to be less affected to it, but it is possible, and there have been cases of children infected with the COVID virus.
Yeah. Thank you for that. And you know, talking about children, maybe Dr. Metziger can help us with this question that came in from Ezekiel Adekoka. What are the psychological effects of COVID-19 on children?
Yeah, that's a really good question. So, as I mentioned earlier, children's reactions are going to be largely similar to those that we as adults are going to experience. So, they're going to have the same fears about dying, they're going to have the same fears about their relatives. Hundreds of thousands of cases in the United to go get a test themselves. They'll have fears about, you know, not going back to school and what that's going to look like. So their fears are going to be largely similar to what we experience as adults. Our job is to, as adults, explain it to them and alleviate their fears in a way that's developmentally appropriate. So again, coronavirus, COVID-19, we're not going to pull up the CDC definition of it, right? We're going to talk to them about germs and about how we keep ourselves safe from germs. We're going to talk to them about death in a way that's not as morbid as, you know, people are dying in the hospital and they can't say goodbye to their family members because they have to be quarantined and isolated to stay safe, right? You can talk to them about the circle of life and trees and how, you know, leaves fall off the trees at a certain season and there's, you know, a time and a place for everything. And maybe the earth is cleansing itself right now, right? So you just talk about natural processes that children can understand. If you are religious, you can talk to them about how God is in control, right? And how relatives, if they are the ones who are not fortunate enough to survive COVID-19, are in a better place, right? So the same language that you would use around death in any other situation, you would make it developmentally appropriate for the child in this way. And again, as I mentioned, modeling, right? So as we're getting anxious, how we calm ourselves down, we need to model for our children as we're striving to achieve that balance between, yes, everything is crazy and uncertain, but these are the things that we have control over that we can maintain some sense of normalcy, right? So we're going to keep our same routines and go to the grocery store, but it might look a little different now, right? We're going to have a play date with your friend, but it might be on the house party app or it might be on Zoom. So just alleviating their concerns in that way.
Thank you, Dr. Metziger, really very helpful. Maybe this next question, Mama Wa, that might be good for you to take this one. It's coming from Aliko Dangote. How does wearing the mask protect you from COVID-19? And you're on mute, so unmute yourself for a second.
So wearing a mask basically is really making sure that you protect you don't infect other people. So we encourage you wearing a mask because there are people who don't know their statuses or who don't know if they're infected already. So if they wear a mask, they're gonna protect the other person who does not have a mask. So that's basically how wearing a mask works. And that's why it's so important.
Right. Yeah, thank you for that. Really critical. We keep hearing this over and over again. Mask, 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 so important. So thank you for that, Mama Wa. This other question is, I think this one was sent to me. What is the treatment available right now for COVID-19? You know, as we discussed, unfortunately, we don't have any drugs or vaccines that are specifically known to prevent or to cure COVID. However, we have symptomatic care. If you have low oxygen, you're in the hospital, we can give you oxygen. If there are some of the complications, they can be treated. If you have a fever, we can bring down that fever. If you have a pneumonia on top of that, that can be treated. There are experimental drugs like remdesivir, even the hydroxychloroquine that had all these controversy. There are many studies going around. Some of these drugs are helpful, some of them are not. Only time would tell, and we're hoping that pretty soon we're going to have something. We're going to have something that's effective. But right now, supportive care, ventilation, oxygen, those are the big things we use, and preventing the complications, because COVID can affect many different organs in your body. So treating all of those different things is what helps keep you alive. The other question we have one from Aziz Kamara. Why is it so difficult for the scientists to have a vaccine for this COVID-19? Yema, I'm not sure if maybe you can talk a little bit about vaccines. What are the challenges we're seeing? Why is it taking so long to get a vaccine?
Sure. So it can be a number of things, but most importantly, I think it's important to remember that especially in the US, vaccines have to go through certain phases. They have to go through clinical trials. We have to be sure that when we give people these vaccines that is supposed to protect us against COVID, that it's not going to give us something completely different, or make things worse. I mean, it's really important to make sure that the quality of the vaccine is going to do just that, is going to help either prevent us against COVID, or even if we do have the vaccine and we do get COVID, then it's very possible that the symptoms would be a lot less severe. And so that's one way to look at it, is definitely the clinical trials part, and making sure that it goes through all of the FDA procedures that it needs to go through. There's a lot of procedural loopholes. But then another thing to consider is that aside from the procedures, there's still so much uncertainty around just COVID in general. I think a lot of us are kind of learning as we're going about what this is, what it does when it leaves your body. And so that's going to really impact the way that scientists are moving in terms of making a vaccine, or having to go right back to the drawing board. So in short, there is still a lot of uncertainty. And I mean, I think people around the world are working around the clock on this, and not even just in the US, but it's brand new. It's brand new, essentially. And so still so much uncertainty and lots of research that needs to be done, but also the legal procedural aspects of getting a vaccine out.
Thank you for that. And we know they're racing against the clock. Usually it takes a couple of years to get a vaccine, but we're hearing it might be even a year or so. So everyone, believe me, I think, at the NIH, right. Everyone's trying hard to do the best that they can.
I think right now, a couple that I've heard of is Moderna, I believe, has gone through clinical trials, as well as Novavax. So those are two to maybe watch out for, and I believe there's one more. So it really just depends. Every day and every week it's changing.
Thank you for that.
Yeah.
So this next question, I think maybe all of us can take. We'll do a round robin. I can definitely start, but I think it's an important one, because I know a lot of us have family and our hearts are in Sierra Leone. This question comes from Comfort Bell. What is the most important thing for our African decision makers and country leaders to do during the crisis? I think, for me, our leaders have to take this seriously. COVID is here. It is something, it's affecting people with infections, with death, with loss of productivity, with affecting the economy. It is affecting us on a scale that we have not seen before. So we have to take it seriously. We have to put our resources We have to make sure, I think it's a reminder for us and for African leaders that you have to invest in health. You must invest in health because when you have issues like Ebola and you have issues like COVID, you show how weak and fragile your particular health system is. And when that happens, our societies, collapse to a certain extent. COVID had an extra layer where there are no flights going anywhere. People don't have anywhere to go. So if you have a health system that can't provide something as simple as oxygen, that can't test for certain diseases, you are going to see it impact our societies as a whole. So when we think of Sierra Leone in general, we have to strengthen our health system. We have to invest in health. We have to invest in strengthening our doctors, our nurses, our mental health practitioners, our hospitals. You look at an example of Burundi. I'm sure a lot of people have heard of this recently. The president is dead, most likely from COVID. His mom is dead. The people that are supposed to succeed him have COVID and are in the intensive care unit. So it is a wake-up call for us to strengthen our system. So, maybe we can go, I'm not sure who next wants to talk about this important issue for our leaders.
I can go next. Okay, thank you very much, Fatu. And I think this is a very, very important question or a comment. And, if the African countries pay attention, the other countries in the world that we rely on for AIDS, for different things to carry on our lives, they are taking this very seriously. They are putting resources into addressing the pandemic. Who are we not to apply the same respect to the situation, And basically what we see in, especially our country, Sierra Leone, is it's not just not treating Corona as a serious incident, but we treat everything related to, that's even similar to Corona with the same level of, I don't want to say on seriousness, but we just don't give it the level of effort that is required. And if we continue along this line, if we don't treat our medical personnel with respect, and I mean respect in the sense, don't send them out there without equipping them with the knowledge, the tools and resources that are needed to solve the problem. Because when you do that, you're exposing them to harsh conditions. They're seeing their people die in front of them and they can't do anything about it. That's not good for their mental health. It's not good for their families. And so I think, as a country, if we get together and take this thing serious and give it the respect that it deserves, we can address this. We can solve the problems that we face. But if we don't, I'm afraid we're going to keep seeing these things happen over and over again. So I hope that the current leadership, especially in our country, will take this seriously and address it, because we're not going to move forward if we have a pandemic. We're not going to have businesses running as smoothly as possible if we have a pandemic in the country. So that's my 2 cents. Thank you.
Yeah, no, you bring up very important points. When you look at our deaths in relation to the cases in our country and you compare it to the other countries in the sub-region, we have a higher rate of death. And that just reflects the strength of our health system. If this is not a wake-up call for us to finally strengthen our health system, I'm not sure what else there is. Are the other panelists, anyone wants to add to this question?
Yeah, Auntie Fatu, I definitely agree with you. Over there, and especially here, I think that what COVID really did was just emphasize and bring to light an already broken system. And I think that a lot of the controversy going on here with valuing the economy over lives, I think that because of those values in the first place, and without investing as much as we do in the economy into actual lives that are needed to run the economy, then you know, we probably wouldn't have seen it as badly. So I think this is definitely a huge wake up call. You know, are we going to strengthen public health, or are we going to keep trying to strengthen our capitalist society?
Yep, you're right. You make a good point. You know, we're talking about the African countries, but even here,
Even here.
those challenges, yep, those disparities, we're seeing those disparities with African Americans being more affected. But guess what? You know, I work in maternal mortality prevention, and the same disparities we see in maternal mortality, in cardiovascular health, in mental health, all of those issues we're seeing in COVID. So it's a symptom of what we're not doing right. And COVID-19 pull we always not do. It pull we waste not do. Whether in America, whether in Salone, that's what's happening. We need to wake up. I see you shaking your head, Dr. Metzika. Yes.
Yes, I'm just co-signing your sentiments that it is an entire system that we need to pay attention to, that we need to fix, that we can't focus in on any one part of the problem without fixing them all, right? So how are we going to better identify cases? Are we going to do contact tracing? Don't forget the children, right? We say that COVID-19 affects children less. We need to make sure, is there a new strain? What does it look like, right? Putting continued emphasis on mental health as well as physical health, as well as our physiological responses, right? So just making sure that we as a community, we as a country are cognizant of not just the financial problems that a pandemic might cause, right? But also the psychological, intellectual, familial, societal toll that it might be taking on us.
Yep. Thank you. Mama Wa, you know, any thoughts on this issue?
I think though, in terms of when you talk about health disparities, I think we have to focus on education, because I think when you look at, you know, the statistic, you look at African Americans have all these comorbidities, hypertension, diabetes. So with that, I think we really have to focus on education. I do know that the healthcare system, it's unfair and it is what it is. But in terms on a personal level too, I think we can do better to make sure that, you know, we are doing the right things, like eating healthy, making sure that our blood pressures are within normal limits, diet control. So that's really something I think personal accountability. It's
Thank
important also.
Yes. You raise a very important point. You know, I truly think COVID-19 has affected us in the Sierra Leonean community in the US a lot. When you hear every other day, you hear about someone infected, you hear about people dying, and I think you're right, it's a way for all of us to do better around those things to improve our health. You know, that you bringing that up just makes me remind myself that we need to give a shout out to our people on the front lines. You know, in the US, we Salone people that are really on the front lines. We have a lot of nurses, we have a lot of people working in care homes, we have a lot of people who are critical and frontline workers. We have police officers. So we have people that are going out there, doctors, they are saving other people's lives. And as a side effect, some of us do get infected. You know, so just a reminder to thank our frontline Sierra Leonean workers who are on the front line. Yeah, Dr. Denzel, Dr. Cole, your thoughts?
Yes. So for me, and seeing it from within a clinical perspective and then being forced to work telemedicine from home, at the beginning, it really didn't seem that something that would majorly affect us because it hadn't hit us yet. And I think that's one of the biggest things. When you see it across the sea over in China or a different country, you think, oh, that's bad, but it can never happen here. And then once it hits, everyone's scrambling. I think that's one of the biggest things that we can learn from not only this pandemic, but from this year at home, that you just have to be ready for what may happen, what can happen in the future, because we are not automatically immune or out of the way of anything at any given point in time.
You're right. Thank you for that. Dr. Cole, there was another question that came specifically for you. It said,
Okay.
could Dr. Cole please talk about the need for X-ray or CT scan for diagnosis in COVID?
All right. So when we're looking at X-rays and CT imaging, we're primarily looking for abnormalities of the lungs into where it doesn't look proper a proper healthy lung. And so one of the things that we look for is a consolidation or just kind of thickening within the lungs or fluid rather than air. One of the issues with COVID is that as a viral illness, it causes widespread consolidations throughout the lungs. And it's not only COVID that you can find it. If you have a cold, if you have a flu, if you have another virus, it can look very similar. And that's the reason why testing is so important, because these findings are what we would say non-specific. If I see an X-ray or a CT, I can tell you that the person may be sick and the person may have a pneumonia. I can't necessarily tell you if they have COVID versus another disease just from the appearance. As time progresses and we see more of these studies and we get a feel for it, we can probably say more definitively that this is highly likely to be COVID or suggestive of COVID. But just to take a picture and say that this person has it or not, it's one of those things that won't happen. Every day at work, I see studies of patients where it says positive COVID-19 and those scans and x-rays look normal.
All right, thank you for that. So we have another question from Poti Robinson. This is a testing question. Maybe, it's, should I get tested if I don't feel any symptoms at all, just to be on the safe side? I'm not sure if anyone wants to take that question.
I can take that.
Mm-hmm.
Actually, the Department of Health in Georgia is recommending everyone to get tested. It is important. If you don't know who have it, then you can isolate or social distance and then decrease the infection rate. So really, right now, I know for Georgia, in Georgia for a fact that you can get tested. You don't have to be symptomatic or anything. You just have to look on the DPH website and you can find all the addresses, the phone numbers of testing sites. And also you can look at the CDC website. You can find testing sites for other states too. It's all there. You can look for local or statewide and you can find that information.
Yeah, that's good. Thank you so much. I know that in the beginning we had limited tests and we were trying to ration tests, but now there is a widespread testing availability. So people should be able to get the testing much easier. Another question we have is from Khadija Kamara. What advice do you have for those that are dealing with cancer in Sierra Leone in regards to COVID-19? And I can take that, cancer, people with cancer are immunocompromised, meaning their immune system is just slightly weaker than everybody else. So they are in a high risk category. And if they do catch COVID, they can have more severe consequences for COVID. So really people that have cancer have to be more careful, more, stay home much more, isolate yourself, make sure the people around you are also, social distancing as much as possible, wearing your mask, washing your hands, all of those things that you can do to try to, decrease your chances of getting the disease, the infection. We had another.
May I say something additional to that?
Yes, please.
Also, if you have a chronic long-standing illness, fear of catching this disease is not an excuse not to seek the proper treatment. There has been reports of people saying that they've had chest pain or maybe that they feel weakness and they've missed strokes or heart attacks. And if you're just trying to pick one, you should always try to seek treatment for what you can.
Thank you. That's so important for bringing that up. We've seen, especially in the US, market decline in the numbers of people coming into the emergency room with appendicitis, with heart attacks, with things like that. And we know they're not going away. And you really could die when you don't seek care. You know, I've had family members in Sierra Leone, you know, who were scared to seek care and actually have had, you know, someone die because they delayed getting care because of fear in COVID. So you may bring up a very important point, Dr. Cole, that we should still continue to seek care for when we have health conditions. I think there was one other question that I saw. I'm trying to find it. You know, it was around testing. Oh, okay. So this is a question from Khadija Kamara. Are hospitals in Sierra Leone equipped to handle COVID-19? I can answer a little bit of that question. I do know that there's been a lot of work put into strengthening some hospitals like Military 34 to be able to take care of COVID. Some of the other hospitals have also been strengthened. They've brought in ventilators. There's been a lot more training of physicians and nurses to try to provide care. So I do think that we are better able to treat COVID-19 now than we were a few months ago. However, the fact still remains that our health system has serious, serious challenges where you can't get oxygen, you know, in all hospitals, where there are still challenges with electricity. There are still very few doctors. Sierra Leone has some of the lowest numbers of doctors per population around the world. We don't have postgraduate training. So a lot of the doctors are general trained. We don't have, for example, intensive, we have in the US intensivists, doctors who are trained to take care of critically ill patients. You know, we don't have that specialty there. We have, you know, very few anesthesiologists, things like that. So overall, the health system does have challenges, but I do know that the Ministry of Health has been working to try to strengthen availability of care for COVID-19. All right. So any other, you know, those are the questions that we've had come through so far. You know, for the panel, are there any other things that maybe we haven't discussed that are important that you want people to know about, you know, as we start coming close to rounding up this discussion?
Fatou, somebody has a question, actually. I'm just looking at it.
Yes,
it
please.
says, it says, is it dangerous to wear protective masks for too long? Because we keep hearing breathing in too much exhaled carbon dioxide has health problems. What would you say?
Yeah, you know, that's a good question. So a lot of the masks you can breathe in and out. So cloth masks, you're able to breathe in and out, even the surgical masks and the N95s. For regular cloth masks, most people can wear them for prolonged periods, even for the regular medical masks. So I can give you an example. When I go to work in my clinic or at the hospital, when you get in, we put on that mask and you put it on for the whole day. The whole time, the only time you take off that mask is, for example, when you go into your office or into a quiet place, when you are eating lunch or you're drinking water. But you really do put it on the whole time. And for regular cloth or surgical masks, most people do fine because you can breathe in and out through the masks. Now, There are some masks, medical masks, like N95s, that they filter out a lot. It is difficult to wear them for prolonged periods. You know, I put on those masks, for example, if I'm doing surgery, I might have to put it on for 2 hours at a time, but you struggle. So I do think that for the majority of the population, you can wear a mask safely for prolonged periods, but there are some more specialized masks that are difficult to wear for longer periods.
And Auntie Fatu, we should be, if we're wearing a cloth mask, should we be washing those after every wear? Is that correct?
Yes. So when you wear a cloth mask, for example, when you go out and you're talking to different people, it is possible that someone, COVID has virus particles that can land on your mask. So it's very important, for example, that you're not touching your mask and then you're taking it off and touching your face. You can get infected that way, or that you're not reusing a dirty mask. So it is important to wash your masks before reusing.
Would people maybe want to know like the effect of say the demonstrations since we were social distancing? You want to say something?
Yeah, that's a good one. You know, I think we spent a lot of time doing social distancing, staying at home, and then life happens. And given what has been happening in the U.S., people felt so strongly and so passionately that we wanted to go out and protest and share our frustrations. And you saw thousands and thousands of people going out. The problem with that, though, is we're not social distancing with those demonstrations. People are close together. Lots of people were not wearing masks. So there's really a big fear that, we're going to see an uptick. Well, the uptick probably happened because of Memorial Day and Mother's Day. People started going out. So we're seeing some of that now, but maybe in the future we might see an increase. So for Sierra Leoneans and for people in general, it's okay to want to go out to protest, but you have to try your best to be safe. Wear a mask, try to distance yourself as much as you can, wash your hands, use sanitizer, things like that. But we do have to. COVID is probably our new reality for a long time. So we have to be cognizant in everything we do. Ask yourself, how can I make this safer? So that's a good point.
And also the effect of maybe, I don't want to say the demonstrations, but you will see maybe the effect, not immediately, but maybe a month or 3 weeks down the road. So because, the incubation period, if you get infected, you have to wait a little bit. So when we see cases go up maybe in the next week, we got to think back what happened maybe 2 or 3 weeks ago. So
Yep.
I did hear that a lot of testing places, if you just mention over the phone that you have been protesting, then a lot of places are trying to get you in there as soon as possible. Because again, like you mentioned, racism is also a very deadly pandemic.
Yeah.
Right, and you would think that most people who are demonstrating are minority, and so it's just a
Yep.
getting effect. You're right.
We've had a few more questions come in. One is from Kathleen Sablotsky. Do you think it will be safe to travel at any point this year without a vaccine? And if we do, should we quarantine after? That's an excellent question. I do think in general, we should try to minimize travel, but we know we can't minimize travel to zero. Some of the things that people are doing, for example, is, it's summer, people want to, they've been cooped up for so long, they want to take a road trip. Now, there's something called your quarantine bubble and the people in your quarantine bubble. Those are people, for example, I'm at home with my husband, my kids, my mom. Those are people that I'm at home with, and we've been sharing a space with without necessarily wearing a mask. Now, if I wanted to do a road trip and I rented a house and it's an Airbnb, and I'm going to that house and I'm trying to stay in that house and maybe go exercise, hike in the mountains, not be around a lot of people, not go to restaurants, eat at home, things like that. There is a way you can do things safely. Now, what's not safe is you might decide to go to the beach and join all those people having pool parties where there are hundreds of people and you're close together. Well, maybe that's not as safe. So there are ways that you can do things safely. There's a resource out there that was published that showed levels of safety. For example, eating in a restaurant on the inside is not as safe as if you have to go to a restaurant. Well, if they have an outside space and there's, you're 6 feet away from another group of people, where maybe that's better. So there are levels of safety, and you just have to look at what you can do yeah, go ahead.
Also regarding that, you should also be your own advocate for your own health and do things that make sense for you, not that other people are doing them, because at the end of the day, you're the one who will have to live with the effects and what happens. So if it takes a little bit more self-control to say, I don't need to go to the store 2 times a week, maybe just once a week, and buy more over the course of an hour, then that may be a decision that you need to do just to lower your exposure and lower the risk to your loved ones.
Yeah, that's a good one. We have another very good question. We're going to ask all the panelists. It comes from Abdul Hamid Dania. Assuming there is a vaccine in a couple of months, how many of you panelists would be willing to be first in line? I personally will be first in line. I want a vaccine. I want it desperately. I am confident that we have the safety measures in place with the NIH, with all the rigorous testing, that by the time they've done animal studies and phase 1 and phase 2 studies and they open it up. But I'm a healthcare worker. I take care of COVID-infected patients. I have family members that are older that I don't want to get infected. I want to get on a plane to go to Sierra Leone and to travel the world. So I personally will be first in line. Panelists, what are your thoughts about the vaccine?
I'll get it.
Me, I go forward, so.
Waiting?
I go forward first.
So, Mama, why you get forward? Please explain.
Well, because with all that's going on now, such like Aisha said, so much misinformation. I just want to make sure that they got it right before I go in for it.
So you want to see us go first, and then you watch to see how we are doing.
That's exactly right. And I'm going to give you guys a whole year to see how that's working for you.
All right. We heard what Mama said. Dr. Sharif, what are your thoughts?
I'll get the vaccine eventually, but my only problem is that the time, usually vaccines take a long time, and the sample size of the clinical trials are usually large. And we know for a fact that once the vaccine or medication goes to the market, all of a sudden the population size increases, right? So it's like a big clinical test. So with the time frame that is given for this new vaccine, I'm just a little skeptical. I mean, I'm uncertain, but I will get it if things, if it comes to it, because why not? I mean, I think it is really the only way we're going to get back to normalcy through a vaccine. So.
Yema, what do you think about this vaccine?
I definitely have to get it for work as a federal government contractor before I step foot back into that building. But I'm very familiar with the, anti-vaccination sides of the argument. A lot of it is deeply rooted in, again, racial tensions, and just historically a lot of things that happened back then. So I get why a lot of people would be skeptical about getting the vaccine right away. I was just talking to one of my friends about this actually the other day. So, personally, on a personal level, I'm going to be one of the first to get the vaccine, hopefully because of my job. And again, I think you have to think about how you want to contribute to getting back to normal, and not even just the new normal, but what do you, if there's a chance that I can help protect my family and my friends, then that's just something that I'm going to have to do, even other outside of work. So I get why people would have reservations partially, but again, it's about also protecting the best interest of the public's health. So,
all right. Dr. Metziger, what about you? What do you think of this potential vaccine?
I'm excited about the prospect of a vaccine. I am overly cautious by nature. So just as I will be one of the last people to step outside of my house, I too will be in the second round of vaccines. So I'm going to see how you guys do out there in the world, going to restaurants and clubs and the movie theater. And then as you get vaccine, I'm going to, peek my head out and see how you're doing as well. And then, much like our return to campuses are being done in stages, I consider myself, kind of the intermediate, right? So I don't need to be the forefront and one of the first ones. But I do look forward to a vaccine, and I do look forward to, of course, being able to travel again and gather, right, without these major concerns. So,
Dr. Cole, what do you think about the vaccine?
For me, it probably isn't really much of a choice. I can see them requiring it, saying that in order to have patient contact, you have to have either so many negative antibody tests either right before or an antibody or a vaccine prior to it. One of the opportunities that I do with Medicare assessments, they're starting back up with in-home assessments, and to start that, you have to have a antibody screen prior to even starting to go back to do that. So it's something where I think the more contact that you have, the more likely it's going to be a requirement. Whereas if you're more on the support role or not directly in patient contact, then it may be a little bit more optional.
Yeah, thanks. And I think you can see from the panel, really, if you are in the front line, whether you're a grocery store worker, you're a nurse, a doctor, a policeman, those are people that I think you'll see a lot of those people really wanting to get the vaccine because they know they're at much higher risks. If you can stay home, and you're not required to be out, then you do have that luxury to kind of see how people do. But one of the things that I'm very happy about is that you see from this panel that whether we want to get it now, we want to get it later, a lot of us feel very positive about the vaccine. So for the Sierra Leone community, once we get a safe vaccine, we hope that you will be able to benefit from that. We had a few other questions come in. Is it true that the virus lasts on surfaces for longer than 6 hours? And I'll answer that. According to the CDC, we do have current evidence. Some studies have shown that the virus is called SARS-CoV-2. It can be alive for hours to days on some surfaces, on a variety of different materials. That's why it's so important to clean and disinfect surfaces, especially if you have someone at home that has the infection, making sure they are in, for example, one room and one bathroom that they use by themselves, cleaning surfaces, making sure they use their own plates and things like that, and don't share all of those things that can help to decrease the spread of the virus. Another question we had, Tanya Lee had a question: how can we get healthcare professionals in Sierra Leone to participate in these discussions and information sharing process? That's a very good question. Actually, I am a part of groups of healthcare professionals in Sierra Leone, and I did share this information with them. A lot of healthcare workers now, our world is very connected. So I'm sure there are lots of people from Sierra Leone who are watching this, learning from this. But you bring up a good point, and maybe something we can talk about the organization, maybe what some of the goals are for trying to do some of these things. Can anyone address that? You know, around Salone Health, does anyone want to talk about Salone Health and some of the things that I know you want to do around sharing information? Today is an example of sharing information with the community, but I do know you are thinking of sharing information and mentoring and things like that. Dr. Cole or Yema, want to comment on that around the missions of the organization and where people can go to learn more about Salone Health?
Yeah. So for right now, we really want to encourage people to visit salonehealth.org. If you didn't get the link from one of us or who sent it to other people, then definitely go check out salonehealth.org. And we are a relatively new coalition. And so actually, as we're going along, we're going to be really making sure that we're honing in on establishing our mission, establishing our goals. And so, like I said, it's relatively new, but we want to continue to have informational webinars, informational events, just really educating and strengthening our Salone American community here, all across the US, in Georgia, in DC, Philly, New Jersey. So please look for updates from us. I believe that there's a list going around. It should have been on, was it on the page?
Website, yes.
Salonehealth.org page. So please sign up to that listserv and stay updated periodically. Again, we're really new and we're still sort of just establishing it, but ultimately we want to make sure that we're strengthening our Salone community here and making sure that we're always keeping people up to date on what we know to help us move forward. Not just for.
Thank you for that. Salone Health, the organizers, I think this next question shows how critical it is to have an organization like this. It comes from Dr. Ahmed Sisse. I am a pulmonary critical care physician. How can I and other healthcare providers in the diaspora help the public health situation in Salone? Look, I just talk say Salone no get pulmonary critical care doctor, but we get all in America. I mean, so thank you for putting together something like this. This doctor can join this community. I know that some of the things that have been happening in Sierra Leone, for example, was Johns Hopkins University. We have a Sierra Leonean physician who works at Hopkins who helped organize training. The anesthesiologists and doctors at Hopkins trained doctors at Military 34 on how to use these the ventilators, machines like that. So we have, for example, a pulmonary critical care physician, and Dr. Sisse, please send me a message on Facebook and I can connect you with some of the organizations where you would be critical. You can have training sessions, you can have those exchange of ideas with doctors on the ground. So thanks to Salone Health for putting this together. Another comment along those lines by African Star. He said, it's good to see our diaspora community come together. Thank you to all of the organizers. And so we have a few more slides that we can just go to as we finish and round up this. There are a few more questions, but again, we will get to them, maybe answer them on Facebook in the comments. So maybe we can go to the last few slides as we just have a few minutes remaining. And we've done the discussion, and closing, I believe, is Dr. Cole.
All right. So thank you everyone again for joining us this evening. We hope that this information was useful and valuable for not only you, but your loved ones as well. This is not only a one-time adventure. We hope to provide future sessions and promote health and well-being of the Sierra Leone community. Please join us at our website, salonehealth.org. You can help us by donating or volunteering. We are also available on Facebook, Instagram, and Twitter. We welcome all in our initiative. Don't forget to like and subscribe this video. All feedback is welcome and appreciated.
All right, so go ahead, Dr. Cole.
Oh, and so a special thanks to our host, Dr. Fatou. We have a list of speakers, myself, Auntie Mamua, Aisha, Ed, Juliet, and our content developers. Really shout out to Dr. Heather Cole-Lewis, Dr. Yasmin Cole-Lewis, Ms. Hamida, Mr. Ndigi, Miss Minnie, Miss Novel, Mrs. Ani, Cardell, Aisha again, Ayat, Juliet, and Henry. There was so much work put behind what you guys saw today that this would not have been possible without any of them. And they're still keeping this machine going as we speak.
All right, so thank you so much to everyone, to you listening at home around the world. We saw that we had people from many different countries here in the US, and I'm sure we had, I know we had people at home in Sierra Leone listening. Thank you to the organizations for putting this together, Salone Health, to all of the organizers, and to the panelists. It really has been a pleasure to work with you and to interact. So thank you, everyone, and good night. Bye.
Bye, guys. Thank you so much for everything.
Bye.
Thank you for letting me be part of this.
Bye.
Bye, guys.
Everybody.
Bye.